Great, thank you so much. Welcome everybody, good morning. It is the PM committee, graciously meeting before the PM time as we do now. We're going to look to the committee right now to see if there are any pecuniary interests. I'm seeing none and I've received none, so with that we will move on. We've got Dr. Greensmith here from Public Health to give us an update as Acting Medical Officer of Health. Dr. Greensmith, sir.
Good morning. Sorry, just fiddling with the screen there. Sorry to hear about Mr. Stark's dental problems. I hope you're recovered. Anyway, so good morning. So this is a report I gave at the earlier committee as well. So in terms of a medical officer update, we have 30 active cases in the community at the moment, 2 in the last 24 hours, for a total of about 3,729 overall. We have no new deaths. We have no outbreaks. We have had cases in schools which have not resulted in mass exclusions. Of the variants of concern that we've had isolated in the community the last 30 days, all of them have been, there's 22 of them, all of them have been Delta variant. I'm going to say here that I was a councillor at the last meeting presented a paper saying that she was aware of some study that had done 1,500 tests and they were all influenza. Nothing was COVID. Well, that paper's been shown to be a hoax. And there's no foundation to that as well. It's difficult to understand where that could come from, but we definitely do have COVID here in the community. These numbers speak to it. And we get the lab reports. I get all the reports of the cases as the MOH, and it's very verifiable. So that particular paper, it's purportedly from Cornell, is a hoax. So going on to vaccines, we've given 170,246 doses. 79.3% of our eligible population has had 1 dose. 73.7% had 2 doses. Youth is slightly further behind than older adults. We've seen an increase in our vaccination appointments, especially for first doses since proof of immunization mandate has been announced. In fact, we did 1,838 doses in the first 2 weeks of September. We're still encouraging those under the age of 40. That's where a lot of our catch-up needs to be done. So we want everyone to get vaccinated. It's for you, it's for your community, and hopefully it will keep us safe. The vaccines are available elsewhere than our offices or our clinics in local pharmacies. We have mobile clinics, and we're gradually bringing on primary care practitioners too. There's been statements about third dose of vaccine, which has been perhaps a little confusing. It was updated again yesterday. This is mainly for those that didn't respond so well to the first 2 doses because of their immune systems being impaired by treatment or disease. And we've given just over 300 cases of that. That number also includes starting to give third doses in long-term care as well. We just as a reminder, if this is public, we have had people appear at our clinics asking for a third dose, but without proof or a recommendation from their physician, and we can't accept that. We're looking, it's a small pool of people that are eligible at the moment. The criteria on our website it still revolves around your impaired immune system. And you need in order to process that, we need a note from your physician to say that you're eligible, because we don't know otherwise. So as I said, we're working with long-term care and First Nations and high-risk retirement homes to give these extra doses. The vaccine passport is announced by the province, and you need a vaccine receipt in order to get that. And we're working with the country library to help print that off for people that maybe can't do that themselves. You can either download it directly from the provincial portal, or they'll work with you at the library to do that, or you can call out after hours, our call number. You do need your green photo health card, your date of birth, and your postal code in order to access it. And if you don't have those, there's a way around that as well. You can call us. So we continue to hold some smaller clinics at Great Lakes Secondary School and mobile pop-up clinics. I think then we're working on the vaccine passports. There's still lots of questions around that, but it is a mechanism to help keep us all safe and has promoted increased vaccine uptake. So I think that's my report. I can take your questions if you wish.
Thank you, sir. Appreciate that. Councillor Stark, questions for Dr. Greensmith, please.
Yes, Dr. Greensmith, thank you very much for your update. I wanted to let you know, and I suspect that you do know, that the City of Sarnia Council has put forth a resolution towards towards disclosure of double vaccination to be effective by October 31st. That was in response to your essential challenge. And I also note that the City of Sarnia's staff have also followed suit. The reference that you made to the AM committee, a councillor put forth a study or a purported study of 1,500 people. That same study was put forward at the City of Sarnia Council meeting on Monday. Unfortunately, we didn't have somebody with your knowledge to be able to refute that. Could we ask you to put in writing a response to the fact that that was a hoax, and that the record can be corrected as to what the Sarnia City Councillor put forward as being fact?
I'm not sure about the technicalities of that. Certainly I can speak to it. It's in the Associated Press, reported it as well this morning. So if I'll find out the best way of supporting or correcting that information for you. Yes. Okay.
Thank you very much.
Mm-hmm.
Okay, thank you. If anybody on this committee has any concerns regarding that, happy to hear about that as well. I see no issue with that myself, but just want to make sure it's okay with the committee. Councillor Loosley?
Thank you, Chairman White. I just wondered, Dr. Greensmith, when you do come up with something for the City of Sarnia, I wonder if we can have that go to the county to be circulated to all the municipalities, because I think that's important information for all of us to be aware of.
Certainly. Yeah.
Thank you.
Great, thank you. Any other questions at this point for Dr. Greensmith? Dr. Greensmith, I have one, just while we're talking about debunking information or correcting or verifying information. Earlier you had made a statement that getting the vaccine was for you and for your community. community. Would you just mind if, or if you don't mind, could you just clarify again the doing it for your community part, how the vaccine may or may not affect the transmission of COVID? I think there's still a lot of questions out there as to what the current science is on that.
Yes, and it does change frequently as more research comes available. The point is that you build up a herd immunity, it's called, that we help protect ourselves individually, but in protecting ourselves, we add to the total number in the community so that would not become infected. And if don't become infected, then you're not going to transmit it to others. So you protect others. So we do recommend that you get it, and certainly if you have serious illness, those around you will get it to protect you. We do that for influenza, we do that for COVID. What you're perhaps referring to is that this new variant, or not so new now, but the Delta variant is more transmissible. It's in the nose, and it's possible that there are some reports of that being spread onwards from those that have been vaccinated. That's not entirely clear, but this is, we're learning as we go along. There's more research. So the recommendation is to get vaccinated, and that will help protect you, and that will help protect those around you, your loved ones, your work people, fellow councillors, whoever. We're all kind of in this together, you know.
Yeah, no, absolutely. Thank you for that. And of the current cases right now, are you aware of the vaccination status of those cases?
Only by privileged information. We have less than 5, and so we don't report on low cell numbers in case we identify somebody inadvertently.
Okay.
And I can speak to the province a little bit, that it's less, this is a dose of intensive care. It's a disease of the unvaccinated. And but there is some breakthrough, but it's like only 10% of those intensive care have had the vaccine. So it works for most people. Unfortunately, not everybody, but that's what we have to hand at the moment.
Thank you. Councillor Stark?
Yes, Dr. Greensmith, I failed to ask this question initially, but I want to make sure that this is clarified. Has the Minister of Health restricted your authority in the fact that you are an acting health authority for our region? Is the fact that you're an acting health authority, has it been restricted in any way by the Minister of Health?
Well, that's a legal question. I say that as far as I'm concerned, no, it hasn't. I was appointed by the Board of Health, which is constituted as county council, and they have the authority to appoint an acting medical officer of health. That's to cover off, you know, what's happening now, a temporary absence, or while you're looking for a new MOH. And I don't know if Mr. Tithow's on, but I was appointed by due process and have all the authority. That's the point of having an MOH for a short period, is that if needs must, orders under the Public Health Act can be signed off according to what's required by law.
Thank you.
Thank you for the clarification.
Yeah, thank you for that. Good question. Any other questions for Dr. Greensmith? Well, sir, thank you so much for your time, as always, and we appreciate the efforts you're putting forward on behalf of the community and on behalf of our committee here. Your time is precious, and we thank you so much for joining us.
Okay,
and we will...
Whoops, I didn't mean to turn myself off there, but I did. Thank you. Goodbye.
Thank you. Take care. Okay, great. We will move on. Item 4 is long-term care. We have 2 information reports, a COVID-19 update report and a scheduling modernization project report. I will look for a motion to receive both of those reports, please, at the same time. Councillor Ferguson, Councillor Stark seconds that. Any questions? Yes, Councillor Cook and then Councillor Stark, please.
Thank you, Chair. Through you to Ms. Joris, just comment about both reports. Actually, the first one, it's great to see that we don't have any COVID cases in deaths in our long-term care. So it means our staff are doing an excellent job about maintaining the good work that's there. And second, on the funding for the second one, even though you've got money that's coming into the program to prop up for the full-time work, are we going to have enough bodies to actually do the work that's going to be there for that?
Through you, Chair White. It is a concern, which is partly why we started this project. So we can use the resources we have to cover the care that we need to provide for 24/7 for our residents. So we are working towards being able to implement those hours should they come. We really don't know how many they will be. Initially, the funding was supposed to support about 3 hours of care by the end of this year, but we've not heard of any formulas yet or any information from the ministry of what exactly that means.
Okay, thank you. Councillor Stark.
Yes, Ms. Joris, my question is relative to scheduling, and having employed 50 people at one point myself, I know the challenges of even dealing with a cohort that size. I can't imagine the difficulty that you have with respect to the number of people that you're concerned with. The province has indicated that they are either training or hiring or accessing 30,000 PSW workers. Can you tell me how that will assist you, or will it assist you, given the length of time in terms of training? Will that assist you in dealing with this problem, which quite frankly, I think is going to get worse before it gets better? Your comments, please.
Through you, Chair White, I think that the training will help, but what we've discovered over the last few years, and particularly with this project, is there are barriers to people wanting to work in this sector and in this, particularly in the PSW role. We've hired more people in the last year than we ever have before, and we still can't cover our schedule. And I believe that the data points to a couple of things. One is that people can only come into the sector really in a part-time position. And some of those people have worked and waited for a full-time position for almost a decade because there's a low number of full-time positions and people stay in those positions. So this is what has happened, and what was brought to light during the pandemic is that people have 2 or maybe even 3 part-time jobs. And what we'd like to do is be able to provide people with full-time jobs so that when we put out our schedule, it's covered and we're not having to cobble together many different people to cover the schedule.
Just as a follow-up, I wholeheartedly agree with you on that comment. And would we be more successful? And obviously you need the funding to be able to do this. But would we be more successful if we had a targeted number of additional full-time people that we're prepared to budget for and sell that concept to the provincial government for additional funding? I mean, it's one thing for them to say that they're going to train 30,000 people. Where are they going to come from? Like the reality is that they're not going to be available. Having said that, I have very considerable concerns with the notion of employing more part-time people when we just went through a pandemic that said we shouldn't have part-time people going from home to home. So we need a solution that looks at a longer-term paradigm than what we're looking at now. And we have to bite the bullet, I believe, to come up with a longer-term solution. And as you're building your budget, I would encourage you to embrace that idea. But again, it's your department. Thank you.
I do have a comment, Chair White, if that's okay.
Sure.
So the commission recommendation is in my report, and many presentations were made to the commission to support the increase of full-time positions in the sector. It's a little bit complicated related to the way we schedule people, and will be a significant change for many people to be successful. The province has asked the long-term care associations to chair a committee to bring some recommendations forward as to how the full-time work can be supported and increased in the sector. So there is some work happening and advocacy to that effect. I would also like to add that in our act, one of the regulations is that we have the fewest number of different staff working with each resident. And that's how we get person-directed care, is by having people who are familiar with the resident to be able to work with them. So more full-time staff will also cover our schedule and I believe increase the quality of care.
Thank you.
Thank you for that. Definitely covered off a few questions I had there too, so that was excellent. Great questioning and answers there. Are there any other comments or are there any other questions? I'm seeing none, so I'll call the question on the two information reports. All in favor? That is passed. Thank you so much. Is there any other business from the committee on long-term care? Seeing none. Ms. Joris, anything from yourself?
No, thank you.
Great. Thank you so much. We appreciate your time and excellent reports. Thank you. Off to Corporate Services Division, we have nothing, which is good news some days. So I'll take that as good news today. Mr. Tifo, is there any other business you'd like to bring forward at this time?
Nope, just as I noted with Committee AM, we will have a report in open session and a report in camera with respect to Council COVID-19 vaccination policies for your October 6th meeting. And just wanted to let you know what the schedule was on that and where we're tracking. Great.
Thank you so much. Councillor Stark, other business?
I just wanted to make Mr. Tifo aware that there is a resolution, positive, affirmed resolution coming from the City of Sarnia relative to the topic that you just dealt with.
Okay. Anything else from the committee? Other business on corporate services? Seeing none, on to finance, facilities, and court services. We have one information report regarding debt management. Look to a mover and a seconder to receive that report, please. Councillor Cook, Councillor Loosely seconds that. Thank you so much. Looking for any comments or questions. Councillor Arnold.
Thank you, Chair White. I just had a question in regards to Appendix A, and it talks about the outstanding debt of just under $20 million, and our debt servicing costs, which would, to me, relate tremendously to that, and that cost is just around $5.5 million. Could I invest in the corporation to get 20-some% return like what we have to pay on this, or is there other stuff buried in that debt servicing cost that I don't see any reference to? Through
Councillor, through Chair White, basically, those graphs are a very good news story. If you take a look at the first graph, your debt levels were $27.4 million about 10 years ago, and now they're about 19.9. Your debt servicing costs were about 9.1 million, and they declined to 5.4 million. So both the debt levels and the debt servicing costs have declined, which result in less tax burden for the ratepayer. As far as the analysis about the 20%, there's a variety of factors that go into debt servicing costs, whether it's how fast you pay your debt servicing costs, the term, as well as the interest rate. So I don't want to get to some inappropriate conclusions of excellent rates of return on debt. The county has over the last 10 years has managed their debt levels quite well, and the real picture to basically say is that our debt levels remain low and are quite low for a county our size.
Arnold, follow up?
Yeah, just to follow up, and it wasn't too much farther than 10 years ago. We were at $43 million in debt, and I know the county's come a long way, and that hasn't been without a lot of work and effort by both council and staff. So that's a good news story. But I'm just wondering if we could get a summary of what all is included in the debt servicing and what that applies to, because even interest rates and prepayments don't come up to 20-some% on that level. And maybe it's just because I don't understand what all is included in that, but maybe we could get a breakdown of what's included in that for us in a future meeting, Chair White.
That sounds good to me, Mr. Pilarchio. Is that simple enough to provide?
Oh, definitely. We'd definitely be happy to provide that level of information either through the budget process or through a separate report to wish of council.
Okay. Oh, that would be great. We'll just leave it at that, if you will. And although Councillor Arnold did not disclose any pecuniary interest, he certainly has declared some interest in pecuniary matters. So if you find your way into that locomotive, Steve, I will be happy to jump on board with you.
Sounds Stark. Great, Chair.
Councillor Stark.
Yes, I believe the answer is as simple as the debt servicing includes principal payment. Is that correct, Mr. Pilarchio?
Absolutely. Every debt servicing payment includes principal and interest. So basically, there's a principal payment in your debt servicing charges.
Okay. Well, we'll look for the pie graph on that. Blue color, blue crayon. Councillor Cook?
Yes, thank you. Back in the old days when they used to issue debentures, that would have been an opportune time for Councillor Arnold to jump in and maybe buy some of that debt. I appreciate the report. I think it's a great starting point for where we need to go. We're on a great path to keep ourselves going in the right direction. And I applaud staff and the council for moving in that. I guess the question, do we have much funding in this regarding to the new development that's going with our works down at the Bayside Center? Is any of this involved with that, the debting with that yet?
Actually, for Bayside, the way we're funding our leasehold improvements was through reserve funding. It wasn't through debt financing. So there's no debt on that particular aspect.
All right, great, thanks.
Councillor Stark.
Yes, Mr. Pilarchio, this may be a discussion that's worth having, and Councillor Cook touched on it. In the report, it talks about borrowing as a method of future financing. Given the interest rates as low as they are, would you contemplate or suggest that there's an opportunity to pre-borrow in anticipation of the buyout of that facility 10 years from now, given the low interest rates?
Through Chair White, you'd have to look at the pros and cons with pre-financing. I've never been a big fan of basically pre-financing something because there's a whole variety of factors that go into that. But the councillor is correct that interest rates are very low right now, And basically, if you match, if you're looking at purchasing an asset, you want to basically finance it over the life cycle of that asset. It may be an appropriate measure to take, because rate forecast right now, CPI, I believe, was just announced around roughly 4.1%, highest level that it's been. So, and you got to take a look at the market, and basically market fluctuations with debt is something that should be considered when you're looking at key assets within the county.
Councillor Stark, is that something you would like to have an analysis done and brought back for a conversation?
Not really. What I'm really looking for is at some level to have the discussion, and then if it's appropriate to bring back a report. But I do want the senior management to consider this as a possibility. And if they deem it worthy of discussion at the council level, then a report would be appropriate.
Just the last comment, Councillor Chair White, is that you may recall as part of the 2021 budget, we basically looked at setting aside funding for the potential purchase in 10 years as well.
Councillor Loosely, and then Councillor Cook, please.
Yeah, just thank you, Chair White. I think a simple way to think about this is if we've got some long-term debt or debentures at say 7, 8, 9%, and we can borrow for 2 or 3%, I think it's certainly something to look at. Biting the bullet to pay it off in a savings. So again, I just think it's important for management to take a look at. Maybe this might be a good time to borrow and pay those off if it's worthwhile, depending on the interest rates. Thank you.
Okay, thank you. Councillor Cook?
Well, yeah, thanks. Just a comment, I guess, regarding interest rates. I think right now we're probably going to see, we're getting to the rainbow end of where we're going to see our low interest rates. I think we're pretty much on the bottom end now. Just the fact that inflation is starting to go in a negative way, we're going up. So I would imagine that if we're going to take advantage of any opportunities, it's going to have to be within the next, I would say, 4 to 6 months at the outside, just based on what the financial reports are saying. So I applaud Councillor Stark for thinking about it, and I think Mr. Plarcho could come back with some good information regarding that, what our long-term servicing could look like going forward. Thanks.
Okay, thank you. I'm not necessarily hearing a very clear motion towards that effect. If anyone feels like they've got something they can throw down to solidify that, that would be helpful, I think. Councillor Stark?
I move that we investigate pre-borrowing for long-term investments, whether it be for retiring existing debt or potential future debt.
Do I have a seconder for that? Councillor Arnold. Mr. Tifo, have you got that appropriately?
Yep. So I've got mover. Do I have a seconder?
Yes, Councillor Arnold.
Arnold. So I've got mover, seconder, or mover, Councillor Stark, seconded by Councillor Arnold, that staff investigate and provide a report in respect to pre-borrowing for long-term investments to finance either existing and or future debt.
Okay, and does that jive with the mover and the seconder?
Yeah, with respect to the existing debt, I would put in prepayment of existing debt.
Okay.
Yep.
Do I have any comments or questions on that motion? Okay, all in favor? That is unanimous, myself included. All good. Councillor Broad, you still with us? Just making sure, just checking in.
You bet.
Awesome, thank you. All right, thank you for that. Look for any new business or any other business, any other business. That was some good other business. I see none from the committee. Mr. Plarkio, anything further from yourself, sir?
No, that's great.
Great.
All good.
Thank you so much. We appreciate that. Thanks for a great conversation and your report. On to social services. We have one information report, Child Care and Early Years Service System Plan report, and the attached Child Care and Early Years Service System Plan. Look for a motion to receive that. Councillor Stark. Councillor Cook seconds that. Any discussion? Councillor Stark, and then Councillor Cook, or Ferguson, sorry.
I don't mean to dominate, and I apologize, but these are issues that come up when I'm going through this stuff. It's a comment with respect to Appendix 1, which is on our number 45 and 46, page 25 and 26 of the report. There is a discussion about growth rates for the various communities within the city based upon the 2016 census information. While we do not have anything official, and it's still at the draft stage, the growth rates that we are hearing about at our growth management committee at the city of Sarnia do not agree with the assumptions that are being put forward. Now, I agree, I recognize that the county has not been apprised of this and therefore would not be aware of this, but I have been told that our consultants dealing with the Growth Management Committee are in fact in consultation with the County of Lambton. So I bring to your attention the fact that it would appear the information that we've received at the City of Sarnia would be consistently opposite to what we are looking at in terms of Appendix 1, in that Appendix 1 makes the comment that we are going to experience stable or negative growth through the year 2036. Yet at the City of Sarnia, and I'll use the city as an example, we are operating a different number than what is presented in the chart, but we are operating from a base of 74,600 people. The projected growth rate for the city of Sarnia, based upon our consultants' work, is showing a population base of 86,400 people by the year 2046. And in fact, a significant larger number for the County of Lambton as a whole. So I'm not about to suggest that there's any flaws to the report, because quite frankly, the report was done prior to any work that our consultant group has done. But I bring it to your attention more for information than anything else.
Thank you for that. Obviously, at the time that we adopt that information, we'll be able to pass that on for consideration at the county level. Are there any other questions? Oh, yes, Councillor Ferguson. Thank you.
It's not so much a question as an observation, if I could, to Ms. Calsanti. I stopped in at Brook Central School several weeks ago to see what their enrollment numbers were out there. And on the early on program they handle at Brook Central, what I found there when I get talking to staff is that from 3:30 till say 6, like the kids are sent home at 3:30, they're picked up. They could really use people look after the kids from 3:30 till 6 or 6:30, because people don't get off work till 5 or 5:30. Has that ever been discussed to have lengthen that out, or just a question?
Through you, Councillor White, or Chair White, to Councillor Ferguson. On the call with us today, we have our Manager of Children's Services, Melissa Fitzpatrick, and I'll see if Melissa is able to answer that question.
Thank you, Valerie, and through you, Chair White. With regard to before and after school programming, which is it's what you're referencing, that's been identified as one of our key priorities in the plan. So we certainly realize around the county, before and after school programming definitely lacks in some areas. The other thing I would add is every year in September, we survey parents for interest. So although the program needs enough interest to be viable, so for the operators to make it viable for them. So a lot of families choose not to use it for various reasons, costing or scheduling. But certainly I can take that back to speak directly to that particular operator to see if they're interested in pursuing or perhaps serving those families in that neighborhood.
Okay, Councillor Ferguson, follow up.
So I'm just going to move to a municipal. Not a problem, but what I see here is that when I go to my municipality and I look here at, we're having over $300,000 deficit in our arena per year. And that really services a smaller group of kids. It's too bad I couldn't get the municipality to recognize that the other children that don't do the sports, that do have needs. And it's just an observation. Thank you.
Thank you for that. All right. Any other questions, comments? All right. Well, we'll call the question on that to receive this report. All in favor? That is passed. Thank you so much. Is there any other business from the committee? Seeing none. Ms. Colasanti, anything further from yourself?
No, nothing further. I just did want to comment on Councillor Stark's notes. So the appendix that we use is just the background that we've provided. Every year when we receive expansion dollars, we take a really good look at what's happening within the community, meet with all of our childcare providers as well as the boards of education, and would be reviewing school enrollment at that time. So although this is a 5-year plan, those types of things will be looked at every single year.
Okay, thank you. Seeing nothing else, then I guess we'll move on. So thank you so much for your time and your report. It was excellent. And that's it. We have no in-camera meeting to report on today. So with that, I'll look for a motion to adjourn. If anyone wants to step up. Ward Marriott, thank you. Councillor Ferguson seconds that. All in favor? All right, excellent. Thank you, everybody. Councillor Arnold wants to hang out longer, apparently, but he's been voted out on that one. So, sorry, Steve. We got to go.
Have a good day.
Thank you, everybody. Peace.